Hey guys, Dr. Bergman here at Rosemary Jones Chiropractic. This week's video we're going to be talking about lumbar spine x-rays and what the lumbar spine looks like when it goes through the degenerative process. So on this first x-ray that we're going to take a look at, this is a normal x-ray, an ideal x-ray from the side view. So we've got a nice thick disc, vertebra, thick disc, vertebra, disc, vertebra, and that alternates all the way up through the spine. Now, similar to the cervical spine, we want a curvature in the lumbar spine as well to act as a shock absorber. That curvature in the lumbar spine should measure between 50 and 60 degrees. In the cervical spine, we are looking for 35 to 45. In the lumbar spine, we need a little bit more, between 50 and 60. And this particular individual is measured at 52 degrees. So everything looks great from this side view. Now these dark holes that are in the back here, that's where the nerve comes out from the spinal cord. So if you watch that first video, we talked about how that nerve can be affected if those holes start to close up. That's the holes that we're talking about, is in the lumbar spine. They come out from the back side there. So everything on this x-ray looks exactly the way that we want it to. Now in this x-ray, we've actually got a little bit more curvature than we want. There's a 66 degree curvature. Again, we want to fall between 50 and 60 degrees, but there's still nice thick discs in between the vertebra. Everything looks good. There's nice open holes for those nerves to come out. Really not too bad, besides there's a little bit too much curvature in the spine there. On this particular x-ray, this is where we see the first phase of degeneration. So we're starting to lose some curvature there. This particular patient has a 33 degree curvature, so almost half of what we'd like to. And there's a nice normal space as we go down, but when we get to this last space there at the bottom, we start to lose that space. We're losing some of that fluid in the disc there, and that's much closer than we would like it to be. So in the first phase of degeneration, we don't really see any bone spurs start to develop yet, but we start to see some loss of space there. On this next x-ray, this is phase 2 of degeneration. So we're starting to see some of the bone spurs develop from this view. So you can see where these red circles are. There's some points, or they look like little beaks coming off of those vertebrae. That's what arthritis, or that's what bone spurs in the spine look like. Now in this particular individual's case, he hasn't lost that much space in the vertebra, which is good, but he is starting to show some signs of degeneration with those bone spurs. So this is really where we want to catch people before it gets too late. If we can catch them at this point, we can really stop and slow down that degenerative process from occurring and try to keep those discs as healthy as possible. So this is a great time to catch that patient so they don't develop more consistent long-term pain. Now in this next individual, this is where we're trying to avoid. When we take this x-ray, we've got multi levels of degeneration here. There's phase 2 degeneration up here where we can see the bone spurs. Right below that, this is what a surgical fusion in the spine looks like. This is what we're really trying to avoid, is to have these screws placed in there, and obviously that's permanent. These are going to be there to stay. On the bottom here, there's actually 2 vertebrae here. It's hard to tell because those bones are pretty well fused together. So this is what phase 3 of degeneration looks like. We really want to try to avoid getting to this point. This particular individual came in, they were having a lot of consistent low back pain. We've been able to help them, but it's something that they're going to have to deal with, and we're going to have to manage throughout for the rest of their life. Now, when we take these x-rays, this is really what we're trying to identify, is what phase of degeneration you're in and what the mechanics of the spine look like. So we can identify it, slow it down, and we can really stop that progression from happening. So if you know of anybody that may have degeneration in the spine, you think you have degeneration in the spine, we certainly want to catch that before it becomes too late, where it becomes a surgical case. So I appreciate you guys watching the videos. If you've got any questions or comments, certainly leave those for me. And again, I appreciate you guys watching the videos. I'm Dr. Dave Bergman here at Rosemary Jones Chiropractic.